Welcome, everyone. This is Dr. Jim, and you are listening to the Forensic Investigator podcast. This episode examines the death investigation system in America through the lens of crime data, the police agencies, the coroners, the medical examiners, and from the perspective of the medical legal death investigators. All with comments and opinions from your host. The law enforcement landscape includes roughly 18,000 police agencies, where 80% of them have less than 25 officers. Across the board, they are all understaffed and underfunded. Crime data is provided to the FBI by police agencies on a voluntary basis through a system previously known as the Uniform Crime Reports. That was augmented for homicide data via the Supplemental Homicide Reports. But starting in January of 2021, the UCR, or Uniform Crime Reports, transitioned to the National Incident-Based Reporting System, also known as NIBRS, N-I-B-R-S. A much more inclusive crime data collection program, but still on a voluntary basis, where many agencies do not report their data or only report a portion. For example, Chicago. The city has led the U.S. in the number of homicides for years. Rarely, if ever, has it reported their clearances or the number of those homicides that were solved. New York City, for example, went through a 3 or 4 year period where they never reported homicide data. Our jurisdictions have been either entirely missing from the rolls or only reporting some of their data. As to the real status of crime in this country, we really do not know because the data is incomplete and even in some instances unreliable, making the national picture inherently incomplete. But it is all we have. That said, let's talk about unsolved homicides for a minute and solve rates. Since 1980, we have accumulated over 300,000 unsolved murders, with an average clearance or solve rate of 62%. Since the year 2000, we accumulated over 167,000, with a solve rate of 59.2%. Then, for the most recent time frame of the past 10 years, we accumulated over 82,000 unsolved murders, with an average solve rate of 57.6%. Note that the solve rate is steadily declining. Then, there is the estimated 40,000 unidentified dead bodies across the USA under the control of the coroners or medical examiners. But I must admit that there are a lot of actions and programs in place to try to resolve that problem. From a historical perspective, in the 1960s, the solve rate was about 92%. Then, in 1993, we had over 25,000 homicides, the most ever in our history, with a clearance rate that year of 67%. Over the next 20 to 30 years, the number of homicides has dropped about 40%, but the solve rate has remained in the low 60 percentile or even lower in a couple of years. In 2016, we had a national solve rate of 56%, which was the first time in our history that it dropped below 60. And that happened again during the pandemic years. Now, in my view, there is nothing in the death investigation process that is absolute, because the evidence, the decisions, and the outcomes are all based on probabilities. That said, keep in mind that regardless of all the technology and efforts by investigators, Not all homicides are solvable. A few years ago, I served as a member of the National Institute of Justice, NIJ, Cold Case Working Group that developed the national best practices for implementing and sustaining a cold case investigation unit. In addition to previously conducting numerous cold case investigation seminars for detectives and reviewing several unsolved murder cases, I have long advocated for addressing the growing cold case backlog. However, focusing only on cases that have become cold may be too late. Believing that in order to prevent cases from going cold, we should stop the bleeding at the source when the homicide first becomes known to law enforcement. Placing our money, manpower, and time to the process at that point, when it all begins, would hopefully preclude the cases from getting cold. There is a broad agreement that long-term root causes of all this are poverty, limited educational opportunities, and fragmented family structures, which exist and are difficult to change quickly. But near-term improvement opportunities, including evidence-based guidance, consistent oversight, and accountability, are possible to achieve. In my view, again, the persistent constraints are clear. Insufficient staffing of police and medical examiners' offices, inadequate funding of both, limited specialized training for police detectives due to the lack of funding, and a lack of enforceable standards for the specialized homicide detectives. Following the NIJ publication, I began formalizing a structured protocol for cold case investigations, where the NIJ guidance primarily targets agency leaders, such as sheriffs and chiefs. This protocol was designed specifically for the detectives, with practical guidance on how to design, operate, and manage a cold case unit. This protocol will be discussed in detail in a later episode. Now on to the actual death investigation system in America. Public narratives often overemphasize detectives, but the medical legal system is a core, often overlooked, partner in death investigations. Because systems vary by jurisdiction, coroner, medical examiner, and hybrid models, a case becomes medical legal when it is violent, suspicious, sudden or unexpected, unexplained, unattended by a doctor, or drug-related. But remember, that varies on the jurisdiction. But with that in mind, understand also that about 90% of all deaths are natural, where family physicians are authorized to sign death certificates and certify the cause of death and the manner as natural. It is the other 10% that we worry about, the most, where collaborative between systems varies by jurisdiction and is not always consistent. On to now coroners and medical examiners. The coroner model has historical roots, coming to us from England, while the medical examiner model developed to professionalize death investigations through the use of forensic pathologists. A key distinction is that coroners are typically elected, whereas medical examiners are appointed. Now, across the United States, the structure is mixed, and most investigations occur at the county level, across thousands of jurisdictions. System capacity constraints include major shortages of board-certified forensic pathologists. With the 50 U.S. states, the system is basically as the following. 11 states operate coroner-only systems. 22 states use medical examiner systems, most of which are statewide. And we have about 17 to 18 that operate mixed systems. And it includes the referral or the hybrid models. Approximately half of the U.S. population is served by coroners and half by medical examiners. Most death investigations occur at the county level. There are roughly 2,185 medical legal death investigation jurisdictions across the nation's 3,137 counties. Over time, the medical examiner role evolved to favor licensed physicians, ideally board-certified forensic pathologists. And while certified forensic pathologists are the preferred model, the U.S. system is estimated to be short by roughly 450 forensic pathologists, therefore creating, in some jurisdictions, the inability to always meet the standards designed for them. As an example, many medical examiner offices obtain accreditation through the National Association of Medical Examiners, NAME, a certification process that establishes and enforces operational standards. The Office of the Chief Medical Examiner for the state of Connecticut, for instance, had its accreditation suspended for standards violations, stemming from inadequate funding and severe understaffing, including circumstances in which pathologists performed a number of autopsies well beyond the daily limits set by NAME. After these deficiencies were addressed, the office's accreditation was reinstated. Then there is the American Board of Medical Legal Death Investigators, ABMDI, that became an accredited organization with standards, testing, continuing training, and oversight. ABMDI is the only accredited organization that certifies individuals as medical legal death investigators. They are not law enforcement. Remember that. Medical legal death investigators support the medical examiners by conducting field investigations and documenting scene findings. Many coroners also hold ABMDI certification, which in my opinion has improved the overall effectiveness of medical legal death investigations in this country. In most jurisdictions, medical legal officials have jurisdiction over the body, while law enforcement controls everything else in and around the crime scene. Now, in contrast, there is no widely recognized national certification program with standardized testing, continuing training, and oversight for homicide detectives, or for that matter, sexual assault or child abuse investigators. Now, to become a police officer, the officer does have to pass and maintain certification that usually goes through their State Police Officers Standards and Training Council, POST. But beyond their basic training and certification, there is no certification for specialized skill sets like one would expect for a homicide detective. Everybody else around them in the death investigation system, crime scene techs, medical legal death investigators, the coroners, and the medical examiners, are all certified and have to maintain that certification through regular training and sometimes periodic testing of skills, but not detectives. So in 2021, I formed a group of 8 active and retired detectives from multiple states to develop guidance for homicide investigations. Because there is no mechanism to enforce standards nationally, this effort was published as guidelines and titled Homicide, Guidelines for Conducting Homicide Investigations by Detectives and for Detectives. The working group has distributed thousands of copies to support agencies that chose to incorporate the guidance into their policy or training. It is a not-for-profit endeavor. Over time, it is hoped that this guidance may mature into enforceable standards that will improve the investigative outcomes. But sadly, many police agencies and medical examiner offices today remain understaffed and underfunded. The medical legal death investigation system is responsible for death certification by determining first the cause of death, which is the medical reason for the death, such as gunshot wound to the abdomen, COPD or chronic obstructive pulmonary disease, or maybe some other disease process. The manner of death is the legal classification describing how the death occurred, and have a choice of homicide, one takes the life of another, suicide, where one takes their own life, as in self-inflicted, accident, like with motor vehicle accidents or other incidents that occur that are accidental, natural, where a disease process has taken the life, and then occasionally we see undetermined, where the certifier is not sure of the cause and or the manner of death. But sometimes undetermined is also pending investigation by either the coroner, the medical examiner, or the police. Outside of clearly natural deaths, where a personal physician will certify the death, only a coroner or medical examiner is legally authorized to certify cause and manner of death. Best practice is close coordination with law enforcement. However, collaboration is not always consistent. Please note that a homicide classification for a death certificate purposes does not automatically mean a crime has been committed. Criminal charges such as murder, manslaughter, or negligent homicide depend on statutory requirements and proof in the relative jurisdiction. Nor does a homicide determination on a death certificate obligate law enforcement to pursue charges. But I would suggest that most will conduct at least a preliminary investigation into the circumstances to firmly establish if a law has been broken or not. Investigative philosophy. Treat death as a potential homicide until evidence supports another manner of death. Premature assumptions of natural or even suicide can result in missed evidence and compromised investigations. Accurate medical history from family and treating physicians is essential to determine whether further investigation is warranted. Premature suicide determinations can also lead some law enforcement agencies to reduce or end investigative activity because, in their view, no crime is presumed. Remember, law enforcement does not determine cause or manner of death. That authority rests with the coroner or medical examiner. And there is some risk, because when a death is classified too early, some agencies may terminate investigative actions, believing that no crime is there. To remedy these potential problems, the agencies involved must maintain investigative coordination until all parties have confidence that a homicide has or has not occurred. Professional experience and practice. Well, as a chief deputy coroner, I work collaboratively with 3 different police agencies, routinely sharing information and investigative findings. This practice supported more accurate death classifications and improved the confidence and outcomes across all stakeholders. Let's talk about autopsies and some jurisdictional things. Autopsies are not performed in all cases. However, many jurisdictions require them under certain circumstances, such as suspected homicides, violent, sudden, or unexplained deaths, and deaths involving children under a certain age. Non-performance of an autopsy may occur for several reasons, In many smaller jurisdictions, a leading barrier is insufficient funding at the city or county level. That too brings a risk. When an autopsy is warranted, it should be performed by a board-certified forensic pathologist whenever possible. And with that, I also have a principle that I like to follow. And it's a quote from a colleague of mine. And that is, do it right the first time, as you only get one chance. That is particularly when cremation is possible and future examination may be impossible. Now, on future episodes, I intend to address in length the death investigative process for police detectives with an explanation of how detectives can use a modified scientific method. And in another session, I will spend more time on the autopsy to clarify some of the requirements and responsibilities to include information about basic wound interpretations and what they may indicate. Before I end this session, though, I want to discuss one more concern of mine. I began this podcast by addressing homicide data. I then emphasized that approximately 90% of the deaths in the U.S. are attributable to natural causes and, as a general rule, do not require a law enforcement investigation, though they may require the involvement of the coroner or a medical examiner and medical legal death investigators. This context, though, underscores that the principal investigative burden lies within the remaining 10% of the deaths, which may ultimately be classified as homicide, suicide, accident, or undetermined. For a perspective, the FBI reported approximately 16,135 homicides for calendar year 2024, while for that same year, the CDC reported that the suicides totaled 48,800, nearly 3 times the number of homicides. Over the course of my career, suicides have consistently far exceeded homicides by a wide margin. It is also important to note that these issues are often assessed not solely by total counts, but by rates per 100,000 residents. Consequently, a city such as Chicago, despite recording approximately 750 homicides, may rank 8th nationally because its per capita homicide rate is lower than that of smaller jurisdictions, such as St. Louis, Missouri, Jackson, Mississippi, or Memphis, Tennessee. Now, in early 2025, Memphis was identified as the nation's homicide capital on the basis of population-adjusted rates, and rightfully so to a degree, because their solve rate of homicides since 2010 has been consistently less than the national average due to the lack of adequate staffing and being underfunded. From my perspective, 2 things should drive education, training, staffing, and funding decisions. One is the ever-increasing number of unresolved homicides each year, leaving thousands of families without any kind of finality. And 2, the persistently high suicide rate, which receives insufficient attention. Both underscore the need to improve the system's performance and prioritize accuracy from the outset. And in summary, while most deaths are natural and fall outside traditional criminal investigation, the comparatively smaller share of cases that do require medical, legal, and law enforcement attention carries outsized consequences. When viewed alongside population-adjusted rates, both the burden of unresolved homicides and the scale of suicide deaths warrant stronger resourcing, targeted training, and consistent, standardized investigative rigor. Today's takeaways should be that our national crime data is incomplete. that the medical legal death investigation system is fragmented, and that outcomes can improve through enforceable detective guidance, adequate staffing, and sustained funding throughout the entire system. The end result should be more complete reporting, more accurate classifications, and stronger investigations across jurisdictions. We owe that to the surviving families. I hope you found this informative. And if you should have any questions about this episode or about any of the forensic disciplines I've mentioned, please email me at jma.forensicinvestigator@gmail.com or go to my website at www.jma4ensics.com. For those of you watching on YouTube, the contact information will be repeated at the end. Thanks for listening. Take care. Enjoy. Bye, everybody.